imbalance, if any dysautonomia is there, subclinical imbalances are there. If yes, what is the extent? How much is the damage caused? What is the severity? How is the disease progressing? Whether it is localized or generalized. For example, in diabetes, there is widespread autonomic imbalance. So what is the extent of disease? What is the prognosis? How well is the patient responding to the treatment? To know all this, we need to have the autonomic function lab, which we have in our department. And I had made a special request to Dr. Shawkal to come because I think they have this HRV software in medicine department also. I wanted to have inputs from their side, whether they are doing it on patients or not. We from our side are doing it as far as research is concerned, but not on the patients. So let's see what sir has to tell us, and with that I hand over to you, sir. Thank you.
Yes, help us to know whether this disorder is generalized as seen in diabetes mellitus or it is localized as seen in distal small fiber neuropathy. They are also used to diagnose and evaluate orthostatic intolerance. We all know what orthostatic intolerance is. When a person changes his posture from sitting to standing position, there is certain fall in blood pressure. And we know the physiology behind this certain fall in blood pressure. So our bladder reflexes or bladder receptors, they within a matter of few seconds to few minutes come into action and they try to bring back this blood pressure back towards the normal. So it is not temperature or humidity controlled. So I request the concerned authority to do the review or at least provide us with an AC for our research lab so that we can render our services to the outpatient departments or those patients admitted in the wards. Thank you all.
Since we are having this cardiac deaths here like epidemics, unfortunately it is happening here. So as she said, we can predict the heart failure, which are prone to heart attacks and which are not. So can we incorporate it as a one of the screening methods? And how much is the feasibility for that? Or in this?
It's cost effective. What first living relatives are diabetics or hypertensive. Studies have shown even their functions are There are studies that their functions are compromised and they are more prone to these silent heart attacks or arrhythmias in the future. So everybody in the general population can get themselves screened by HRV. It's a cost-wise very effective procedure, freely available with us.
We can do it, but I would recommend that those patients, suppose the patients come of 22 years getting a stent. Recently, about 3 months back, I had one gym trainer from Manila. He came to my clinic with a chest pain. I did his ECG. There was an ST elevation in the anterior vein, splitting thereby. He had an ST elevation MR. I still had a doubt because my mind did not believe that a 22-year-old male, non-smoker, with no family history of coronary artery disease, very healthy, just 62 kgs in the weight. I have analyzed it like anything. So I did this troponin. It was sky high. So it had clear cut. There was no, I did his echo, there was a valve motion abnormality. I did his echo, his coronary artery left anterior descending it was blocked, 99% it was blocked. There is no history. I am asking my grandma, my group, he asked me these are the risk factors, a patient who is getting a